having an illness and being a receiver of healthcare, being a patient, is, as you all know, there's so many burdens associated with that. I was listening to someone from Press Ganey talk about all the burdens of being a patient. And if you've ever been a patient yourself, if you've been a receiver of healthcare, or if a family member or a friend has been on the receiving end of healthcare, then you're all too familiar with these. And they start with preparing for care, right? So deciding you need care, having the symptoms, trying to manage those symptoms on your own, deciding which provider, where are you going to get care, the location, making those phone calls, waiting for an appointment, sometimes trying to get approvals from insurance, doing paperwork, doing some research on what is the best place to go, and then undergoing tests and figuring out life activities around that, right? So rescheduling things. Then you get to the appointment and you have to sometimes talk to several different people, have to have several appointments, provide your history again, explain to sometimes multiple providers about what's going on, and undergo some treatments, deal with sometimes with the symptoms of those, the side effects of those treatments. Sometimes they work, sometimes they don't work. So then we have to try different things. And again, you're still trying to manage all that anxiety, that worry, that stress, those life activities around what's happening. And you're making healthcare decisions in the middle of that. And sometimes those decisions can be very difficult. They can be very complex. You make a decision, we go on a treatment path, and then sometimes it doesn't work, or it doesn't work as expected. We have to make a detour. There are new decisions to make. We have to start again. We have to reassess our expectations, reassess our hopes, go a different route. And in all of that, patients sometimes feel abandoned. They feel alone in that process. And there's so many burdens that we're not perhaps able to alleviate for our patients. There's so many things that having an illness can be out of our control or the patient's control. But that burden of making healthcare decisions, especially in the context of a serious illness or at the end of life, that is something that we can partner with our patients with, walk with them, provide them assistance with along the way, so that they don't feel abandoned and they have the information that they need to make informed decisions, but that really align with who they are as a person.